Hey guys, it's Matthew Zachary, and I want to tell you about the National Comprehensive Cancer Network, or the NCCN. The NCCN creates the treatment guidelines for doctors that help cancer patients lead better lives. But I want you to know that the NCCN also has guidelines for you. The patient guidelines were funded by the NCCN Foundation and were created just for people with cancer and their caregivers. They're free, they're easy to understand, and they're available right now for you, the patient and the caregiver. So go check them out at nccn.org/empower. That's nccn.org/empower.
Hello, Heart of Healthcare listeners. I'm your host, Hallie Tecco, and for Pride Month, one of the topics I want to cover is trans rights. Across the country, transgender rights are under attack with a torrent of anti-trans bills. From bans on gender-affirming care to bathroom bills, it feels like every week there's a new anti-trans bill from state lawmakers. Today, I'm here with the Folx Health, Folx as in Folx, CEO, Liana Guzmán, to discuss this topic. Liana, welcome to the show.
Thanks for having me, Hallie. I appreciate it.
Gender-affirming care has become more visible in recent years, but many people aren't really familiar with what exactly it entails. Can you explain what gender-affirming care is and why it's so important?
Yeah, of course. So it really encompasses a range of social, psychological, behavioral, and medical interventions, which are meant to support and affirm an individual's identity, particularly when that conflicts with the sex that they were assigned at birth. And so gender-affirming care is very patient-centered. It really treats individuals holistically and aligns their outward physical presentation with their gender identity.
Every major U.S. medical association recognizes that gender-affirming healthcare is medically necessary. As a treatment for dysphoria, it's been called essential and life-saving. So why do some people want to stop others from getting this essential medical treatment? And why has it become so political?
Yeah, I ask myself that question so often, Hallie, because it's just such a difficult and depressing time, to be doing this work in this country. The reality is that this has become a wedge issue. And so I think, there are some incredibly powerful people who have put a tremendous amount of money and strategic work into leveraging misconceptions and prejudice and incorrect information to create what they think is a motivating wedge issue. And, as you mentioned yourself, this is not in line with what the medical community knows to be true, right? The medical and psychological consensus overwhelmingly supports the importance of gender-affirming care. And so I think, they started with this idea of bathroom bills. It didn't quite get the momentum that they were hoping for. And so they pretty quickly pivoted to focusing on children and under the guise of protecting children, when in fact it's doing the exact opposite, right? Study after study has shown that when you engage in gender-affirming care, you reduce suicidality and depression and anxiety. You improve mental well-being. And so what they've done is essentially put a lie out there, right? That they're protecting kids. And then it's a little bit like a frog in increasingly hot water, right? Where they started with children and again, like misconceptions. And so when you say to someone, do you want to protect children? You'd be hard pressed to find somebody who doesn't say yes to that, right? And so, it's about not letting people know what actually protecting children looks like, and then just continuing to amp it up. And so you can see that in the way that this legislation has moved, right? It started with a focus on sports, so really small, and then protecting children more broadly. And now you're seeing a set of states that are putting out, regulations against adults receiving care, and trying to control how adults access care. And so this party that really tries to sort of hold itself under the banner of freedom is really doing quite the opposite and limiting not just people's access to care, but access to life-saving care.
I've heard people compare gender-affirming care to cosmetic surgery. Is this a helpful or harmful analogy?
So I think it's very nuanced, right? And I want to be careful to say that I think people have different desires for or needs that prompt cosmetic surgery, and the same is true for gender-affirming care. And so I would say two things. One is back to the sort of the way we define gender-affirming care. I think it's really important to understand that it encompasses social, psychological, behavioral, legal, medical intervention. So it's incredibly broad, right? And I think the breadth of it speaks to just the depth of need, right? It isn't just about changing one small thing. It's actually about ensuring that people can fully live as themselves. And so, I would say that's one thing. The other thing that I would say is what I find troubling is, and this is true of cosmetic surgery and any other number of medical interventions, those should be decided between a patient and a practitioner that patient trusts. Mm-hmm. What I struggle with is that's not what we're talking about here, right? What we're talking about is politicians introducing themselves into these deeply personal decisions. And so I guess I would say, much like cosmetic surgery, like that's between you and a doctor. You know best whether you need something, and you have a physician who can help you understand what the risks are and what the benefits are, and then you can make that decision. So in as much as that, I think they are similar. I think when people talk about cosmetic surgery, though, I think sometimes there is this lens of superficiality that people are applying, right or wrong. And so I would say in that case, I don't think it has anything. It has, if you're applying that superficiality to it, then no, it is not the same.
Yeah. Yeah, it's interesting because I agree that we'll say, is it not gender affirming care if you get a boob job and plump your lips? And we have no problem with someone making that decision between them and their doctor. And we aren't trying to regulate that. But you're saying it's even more than that. It's this is care that is life-saving, that is more comprehensive than just a cosmetic procedure, and that it can reduce signs of depression, suicidality, and all these other things that come along with.
That's right.
So you've brought up youth a few times, and it does feel like trans youth have been a huge focus of anti-trans legislation this year. First, I want to talk more about folks. Do you serve minors?
Yeah. So clinically, we serve patients over 18. It is now, I don't think that will always be the case. I think over time, it's very likely that we will expand our services, but there's just, tremendous amounts of needs. And as a startup, we have to, focus in. Yeah. So we focused in above 18. That being said, non-clinically, we do, we have a content and community platform and do a lot of education. And so, we know that folks under 18 turn to our content for education purposes. So have had, many instances where we have clinical appointments with parents of trans kids who have questions. They actually do care about the safety and well-being of their kids. And they want to go to a provider that they know is not going to overlay their answers with some sort of personal judgment, but instead is really just going to focus in on what the science says and help them make the best decisions possible for their family. And so in that way, I would say, it's not a direct treatment of folks under 18 clinically, but it is, supporting trans youth in the context of their family.
Yeah. What are the risks and the benefits of allowing children to receive gender affirming healthcare?
I would say overall, I think it's mostly benefit, little risk. Again, the reason I say overall is I think it has to be a really personal decision between a practitioner and a patient. And I think what gender affirming care looks like for any particular person, particularly trans youth, is very different. So for one person, it may be just social, where, you change somebody's name and pronouns and, support them dressing in the ways that feel most true to themselves. I think when people talk about, again, gender affirming, they go right to, surgery and medication. And that's not always where, we're talking about with youth. I think for others, it's actually about puberty blockers. And so it's about saying, look, let's not do anything, but let's press the pause button so that you're not having to do twice as much work to be who you are down the line. And, and then in some cases it is putting folks on hormones. My perspective is very much in line with what the science says. And the science is very clear that the benefits are significant, that, this trans youth have significantly higher rates of suicidality and depression, of feeling isolated and alone. And when they are given the opportunity to pursue gender affirming care in whatever form makes sense for them, those challenges often dissipate, right? I mean, you hear it from parents all the time who say, I had lost my kid, and then we started down the path of transitioning or of gender affirming care, and they came back. They were alive again. They were who they were back. And so to me, that benefit outweighs all.
What % of transgender kids go through detransition versus keep their gender identity as they become adults?
I don't have specific data around that at the moment. What I can tell you is that people who detransition, it's in the single digits of percentages. And those are not all people who have changed their mind, right? So some of it is like folks who have or medically detransition, I should say. So folks who go off of hormones, it may be that the side effects, were too much for them. And so they're finding other ways to focus on gender affirming. For some, it's that, some of this is newer. And so for some folks, it's the realization that actually they identify as non-binary. And and so in a world where you had to choose between one or the other, they felt more like one than the other. But now in a world where they're able to actually be who they really are, which in this case is non-binary, that may lead somebody to decide to go off, hormones. In any case, even with those as use cases, it's an incredibly small number of people who go down this path and then turn back.
Yeah. So how should we be thinking about allowing trans girls to play sports?
Yeah. I will say unequivocally, I believe that folks should be able to play, trans girls should be able to play on girls' teams. And I feel that way for a number of reasons. One is, as a parent, I will tell you, if you ask my kids to tell you what I want them to be when they grow up, the answer is they'll tell you that what I want them to be is brave and kind. And so I will say, as a parent, I would far prefer that the lesson my children learn in whatever sports environment is that we take care of each other and we support others and we create a space of belonging. And so I think
I love that
part of it for me. Other part of it is, you hear people say, well, at the highest levels of competition, it creates an unfair experience, right? And that's just frankly not the case. It's why you see sports organizations like the International Olympic Committee and others who have allowed trans athletes to compete in accordance with their gender identity. And a lot of it is, a lot of these folks are on hormones, right? And so you could very well have a woman who was assigned female at birth, who has higher levels of testosterone than a trans woman on the team. And so to me, again, that's back to this like fear mongering, wedge issue, misconception. It's like this idea that, we're allowing men to compete on women's teams. That's not the case, right? A trans woman is a woman. And so that's why I believe that they should be allowed to compete on women's teams.
Yeah. But maybe the whole idea of having just binary girls teams and boys teams is flawed to begin with.
Absolutely. Yeah. And it just, you get into this rabbit hole of there are some folks who are born with more testosterone. So are we going to start taking measurements of that and only competing with people who have the same levels as you? And, I think it makes it really clear how little this actually has to do with the science and how much it has to do with just people trying to create a narrative to really hurt a group that is already, marginalized.
We'll be right back after the break.
The COVID-19 pandemic showed us how a microscopic virus could upend our lives and how unprepared our society was for it. There's so much more out there that we need to understand, which is why I recommend subscribing to Crooked Media's America Dissected, hosted by former Detroit Health Commissioner Dr. Abdul El Sayed. Each week, Dr. El Sayed sits down with doctors, scientists, culture makers, and policy leaders to ask questions like, how could new genetic discoveries change our relationship with our own genes? How could addiction to social media change our brains? Or how even climate change could make the next major pandemic more likely? To hear discussions on these topics and more, check out America Dissected from Crooked Media. New episodes drop every Tuesday. Listen on Apple Podcasts, Spotify, or wherever you get your podcasts.
A lot of attention has been given to issues like bathroom access and pronoun usage, where I'm sure that trans and non-binary individuals sometimes feel like the world is against them. What are some ways that workplaces, healthcare providers, and allies can be more supportive?
Yeah, I love this question. So first and foremost, center voices of those people that, whom you're trying to serve, right? I remember when I was getting pregnant, my insurance did not cover my IVF because I wasn't in a cisgendered heterosexual couple, but it covered my colleagues' IVF because they were. And that was because nobody sat in the room and talked about my use case when benefits were being determined, right? And so I think one big play here is when you're deciding policies and benefits, make sure that there is someone at the table who can represent others' voices, so do you have trans folks? Do you have people of color? Do you have folks who don't represent your experience so that when you're building these policies, they really are inclusive? Benefits is a big one. When you think about Maslow's hierarchy of needs, in my mind, like you can't do sort of the fulfillment top of the pyramid stuff if you don't have good health. And so I think it is just deeply important that your benefits are inclusive as an organization. And I think a lot of organizations have spent a ton of time and money creating inclusive benefits only to discover that those benefits are inclusive on paper, but not practice. So, you can search for a doctor who has LGBTQIA competence, but there's one doctor and they have a 6-month waiting period, right? Well, that's inclusive on paper, but not in practice. And so we are able to partner with companies and make sure that that's not the case, right? And so I think making sure that you have those inclusive benefits, and then, making support not just something you speak to, but something that is shown in your actions, right? So put your money where your mouth is. Make sure that managers are trained on what to do if somebody comes out as queer or trans on your team, how to create supportive systems for that person. So I think it's about really just showing up in a multitude of ways. And it's the combination of all of those, or the addition of all of those, that really makes a difference. Yeah. And I would say, you mentioned allies as well. I will just say, make sure, my perspective is, it is really important that folks with privilege use that privilege to serve those who don't have it, right? So if you are a cisgendered heterosexual white man, you have so much privilege, and you can stand up and ask for some of these things in ways that, maybe I as a Latina lesbian couldn't, but I can do it in ways that maybe a trans person of color on the team might not be able to. And so wherever you fall on that, making sure that you leverage your privilege to support others.
Yeah. That's great. That's helpful. And I do want to plug a nonprofit I'm on the board of called Resolve. And Resolve has done a lot of legislation, or a lot of promotion of positive legislation to be more inclusive in insurance coverage. So they've already helped change 4 state mandates to include LGBTQ inclusive language around IVF coverage. So let's switch gears. Let's talk about Folx. Folx has been described as the first virtual LGBTQIA plus primary care clinic. What does that mean in practice, and how does care need to be tailored per someone's sexual orientation and identity?
Yeah, absolutely. So I guess maybe to take a couple steps back and then I'll move forward. We were founded about 3 years ago. Our mission was to create, a leading home for LGBTQIA healthcare. And the reason we felt like that was necessary was, again, in the data. 50% of us have experienced discrimination in a healthcare setting. 78% of our members did not have access to affirming or expert care before they found Folx. 71% actively avoided seeking healthcare for fear of discrimination. And, you can't outrun healthcare. So what ends up happening is for that 71% that's avoiding healthcare, you end up with significantly more serious outcomes, more negative outcomes, and at a much higher cost. And so we wanted to create a space where, it wasn't just affirming care. I think affirming care is really important, right? You want to be able to go like, we moved a couple years ago and I went to the pediatrician and their form said mother, father. And I had to cross out father all the way down the form, which, made me uncomfortable. And so I ended up switching practices to a practice that had guardian 1, guardian 2. And that's important. I don't want to underestimate the importance of affirming care. But for a lot of our life, it's not just affirming care, it's actually expert care. So as an example, we are more likely to suffer from heart disease. We are more likely to suffer from substance abuse or behavioral health, mental and behavioral health needs. Even really joyful experiences like building families are different for us. And so to be able to exist in a, we live in an incumbent system that at best wasn't built for us and more often than not is openly discriminatory and even violent. So to be able to, as a patient, be able to come and see practitioners who look like me and have experienced life similar to mine, but also who have dedicated themselves to understanding the science, right? Like we often, like when I think again back to my IVF days, I had to pay out of pocket and I was over pathologized as somebody who was infertile. And so I was not brought into an experience that really was built for a lesbian couple starting a family. I was brought into an experience as a lesbian couple starting a family within the framework of an infertile cis het couple. And so that one felt deeply lonely, right? It's hard to be in a room where nobody else looks like you. And then two, led to unnecessary testing and unnecessary processes that I think could have benefited from, a practice that was focused on my community specifically. So that's why we exist. In terms of how it works, you go on our website. We are primarily telehealth. And so you will go on, fill out an onboarding form, which is an incredibly affirming onboarding form. And then you get to make an appointment with a specific clinician, which is very different from other telehealth services. So versus just being assigned whoever's on, you actually get to read the bios of clinicians in your geography, and then you get to pick who you want to see. And then, within a week, you have an appointment. So typically 2 to 5 days, as opposed to a 6-month waiting period on average nationwide. And then you're able to see us for, as I mentioned, gender affirming hormone therapy, but also broader virtual healthcare. So allergies, derm issues, a cold. And then we just launched a 3-state pilot focused on mental and behavioral health. So both medication management and one-on-one therapy. And we'll look to expand that across the nation. So that's the way the Folx model works. Today we are cash pay, D2C. And we did that pretty purposefully. We wanted to make sure that we never lost sight of who we were serving. And so it was really important that, we centered our members in our product development and our sort of the development of our business. But I'm excited to say that, come this summer, we'll start accepting insurance as well.
Amazing. And so I thought you guys started out just doing HRT, or is that
we did?
Yeah.
We did. Well, for the first year and a half, that's where we focused. And again, very purposeful. The mission was always to serve the broad community, but we wanted to start with the segment of our community that we felt represented the greatest need. So that's why we started there. But then, sort of had two-sided asks. So members who were on gender-affirming hormone therapy saying, for the first time in my life, I have a clinician that I trust. I'd like to see you for more than just hormone therapy. Yeah. Then members of the broader LGBTQ plus community saying, I have trans friends who are coming to see you. I want that same level of care, even though I don't need hormones. And so that's what led us to expand into virtual care. And then roughly 50% of referral requests that we get are for mental and behavioral health. And so that's what prompted us to start our mental and behavioral health practice.
I love it. So one of the things that we always bring up in women's health is when Maven, which has been a very successful women's health company, started, a lot of people told the CEO, like, this is too small of a market. Like, why would we need care just for women? It's too small of a market, which is ironic, right? So what are some of the things that you've heard that you just kind of like laugh off, that are like absurd statements from investors who might not get it?
Yeah. We hear that a lot. We hear like, the TAM just isn't there. The reality is 1 in 10 adults identifies as a member of the community. The number doubles when you go to Gen Z. And there's what I like to think of as kind of queer adjacencies, right? So I think a lot about parents, like the mom that we connected with, where, your kid is part of the community and you want to arm yourself with knowledge and connection, right? Like our peer support groups can help parents who want to support their kids and want to meet other parents who are supporting their kids. And so, my response to that is, one, it is a big and growing community, but also it's a deeply engaged community. So this is a community that really seeks each other out, where there's incredible network effects. Makes it sound business oriented, but essentially, like, we are, we're not a monolith, but we do look out for each other and we recommend things to one another, and there is a desire to connect with one another. And so I think both the audience itself is big, but also the opportunity to serve them across a multitude of needs is big. And so that's typically sort of how I think about pushing back on that. I will say beyond that, we raised a Series B, which we announced last October. And, that was the biggest pushback we got. But what I was surprised by was, and look, maybe it's that we weren't having initial conversations with people who didn't already buy into the need, but I was very pleasantly surprised by how many VCs understood fundamentally that actually there are medically differentiated needs. I was expecting to have to explain that in much greater detail, and people seem to just understand that. There weren't as many questions or pushback around that as I expected.
Yeah. Well, and if they don't get it, they're not a fit. So it's kind of, they self-select out.
That's right.
Yeah. How has the pandemic impacted folks, and what does it look like now that the public health emergency funds have expired?
Yeah. So, I think the pandemic obviously was and continues to be a devastating time for us all. I think one silver lining that came out of it was, there had been a lot of pushback from the incumbent medical system that things had to be done a certain way in order to ensure the highest levels of care. Namely, I'm thinking about, the ability to provide care via telehealth. And the pandemic forced us to actually put that that idea up for, we tested it. We tested whether or not that was true by virtue of need. And what we found was that's not the case, that you can provide really good care via telehealth. And in some cases, like for our community where they face so much discrimination, being able to access that care from the safety of your home means you're actually able to provide better care than you would in person. And so I would say, I think the pandemic and the idea for Folx actually existed before the pandemic, and we were looking into pairing that telehealth with in-person care. The pandemic shifted by allowing us to really focus on telehealth, which allowed us to, we're in 47 states today, allowed us to really expand nationally much more rapidly than I think we would have been able to otherwise. So that is one silver lining. As you mentioned, the PHE is expiring. They just pushed that out. So now it's looking like a November expiration. And then for existing members, they have a full year after that. And so, we've been hard at work building plans to be able to initiate care via in-person and then transition over to telehealth. And so that's something that will shift in the business across the next 12 to 18 months. But, I'm hopeful that part of why the DEA has pushed out this deadline to November is that they're taking the comments that were submitted really seriously. And the comments, by and large, are focused on the fact that when you create an in-person requirement, you are increasing the barriers to care for people who most need it, right? So if you're in a care desert, if you live in a place that only has one health system that has 6 months waiting period, if, there are so many examples of where that in-person requirement, needing to be able to get transportation. There are folks for whom transportation access is difficult. And so I'm hopeful that, when they come back with their official guidelines that they've, softened on this requirement. But if not, we'd be ready to continue to provide care for our members.
Yeah. Well, it's much easier to match supply and demand if you aren't just limiting people to the radius of, 30 minutes within their home.
That's right.
Yeah. Are you guys in every state in the U.S.?
We're not. We're shy by a few states. And those are MD only states. So we're rapidly hiring more to launch those by the end of the year.
Yeah. So if you could wave a magic wand and fix anything within our healthcare system to make your work easier and better and more impactful, what would it be?
Oh, I love this question. This is going to sound simple, but I actually think the impact of it is so deep. I would make healthcare patient-centric. I think when you think about a lot of these challenges that we've talked about, like access and telehealth versus in person, and if you really strip away the bureaucracy and the sort of drive to profit and really just focus in on like, what would we do if we were centering what was best for patients? I have deep faith that the system that would arise from that would align perfectly with the care that we give at Folx.
I love that. Well, and with that, Liana, thank you so much for your time today. Thank you for everything that you do. If anyone is interested in following, Folx Health is very active on social media, has a really great educational account to follow. And the Folx Health website also has a ton of resources and a library where you can learn more about these issues. Any final words?
No, I just really appreciate you taking the time and letting us share our story with folks. So thank you.
Yeah, thank you. Happy Pride Month.
Thank you. Same to you.
Thanks for listening to this episode of The Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of Folx Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our host is Hallie Tecco. For advertising and media inquiries, email media@offscript.com. That's media@offscript.com. For more information, visit offscript.com.